تمام.
Okay. Dear Dr. Ahmed, you are about now to see Mr. Smith, the son of Mr. John, who has been admitted to the hospital 1 week ago with fractured neck femur. 2 days after the operation, he started to have a high-grade fever and cough. Sputum culture sensitivity appeared yesterday night, and he was found to have a MRSA infection. He is isolated in a separate room by the infection control team. His son came today to the hospital and found his father isolated, and he was not allowed to visit him. So he's waiting in the doctor's room to see you. Please talk to him and answer his concern.
Okay. حركة record. Okay.
Yes, Dr. Ahmed.
Good afternoon.
Yes, good afternoon, doctor.
I am Dr. Ahmed, one of the physicians here today. May I confirm your name and address?
Yes. I am Smith, son of Mr. John, who was admitted here in the hospital 1 week ago.
Okay. Nice to meet you. Do you have permission from Mr. John to take information about him?
Yes. Yes, doctor. I'm his next of kin.
Okay. So I believe we are here today to discuss the updates of Mr. John's condition. Do you want anyone else to join our meeting?
No, doctor. I don't want anyone else to attend this meeting, but I feel like my father is getting worse. He came here to treat his bone problem, and now he is febrile, he is sick, he is isolated. I think my father is dying, doctor. What's happening to my father?
I'm sorry for that. I really appreciate your concern. But let me ask you before, what do you know about your father's condition?
Yes, I just told you that my father came here with a fractured bone, and the operation went fine, and he was okay, and he made a very good recovery. And all of a sudden, he became febrile, sick, coughing, and today I came to see him, and they told me that he is in a separate room. He's isolated. I cannot go and see my father. What's going on, doctor? My father is dying or what?
So I'm sorry for that. But let me give you some updates about Mr. John's condition. It is a rather serious problem, as you said, but let me explain it more if you want.
Yes, doctor, tell me what's happening to my father.
Okay, actually your father, as you said, was coming with a fracture in his bone, and this was fixed successfully. But unfortunately, later on, as you said, he developed some raised temperature with some cough. And as a part of multidisciplinary team, we did some blood tests and some imaging of his chest. So we discovered that he has a bug in his chest that called MRSA. Did you hear before about it?
Yeah, no, doctor. I don't know what's MRSA, but what I know that my father came here to the hospital without any chest bugs, without any infections in his chest, and now my father got an infection. This means that he got this infection from this hospital. What's going on, doctor? Please tell me.
I'm sorry for that. I really appreciate your concern. But this bug is actually, we have some sort of these bugs in our normal or the good bacteria in our nose. But while we are in a good health, this couldn't affect us. But in situation such as Mr. John's situation, his defense mechanism or immunity become a little lower than usual person, and he might got some bugs like this that become harmful one and can cause his chest problem. But the good thing is that we have an experienced team on dealing with such bugs, and we have actually started treatment as early as possible. But as you said, as a part of the infection control team recommendation, we have to isolate your father in a certain room in order to avoid spread of this infection to anyone else, and also to protect him from catching any bug from the hospital because of his low immunity. Are you following?
Yes, doctor, but as you told me now that we all have this bug in our nose, so why we are not infected and why my father was not infected with this bug before? I think he got this infection from this hospital. This hospital is not clean, doctor. I saw the nurse and the ward. She is entering my father's room without washing her hands. And I want to complain about this, doctor.
I really appreciate your concern, and I am sorry for that. But actually, I will document this in the file, and we can write an instance report once I have the full information from you, and we can investigate that and raise it to the consultant. Is it okay with you?
Yes, doctor, I want to investigate about this because I saw also one nurse entering my father's room without a clean or sterile gown with her usual clothes, and her hands were not clean also.
I really appreciate your concern, and I am sorry for that. We can also investigate this and report it to our consultant. Is it okay with you?
No, doctor, I want to complain.
Okay. Do you want to complain before seeing the consultant or after?
Yes, doctor, I want to complain before seeing the consultant.
So you have the full right to do that. So I will refer you to one of our nurses to give you more data about the Paul's office, where you can write your complaint. Is it okay?
Okay, doctor. Okay.
Do you have any further concern?
Yes, doctor. Now I want to see my father. 2 minutes.
Okay, I understand this, but actually for protection of you from catching such nasty bug, and also for protection of your father from catching any bug from anyone else, this is our policy regarding this bug. Is it okay?
What do you mean by that, doctor? Please explain to me.
I mean that we have fears that you might catch such a bug or introduce a new bug to your father with a low defense response.
So you mean that I will not be able to see my father at all?
But we can give you update daily. You can meet assigned physician on daily basis, and we can give you a contact number where you can get updates about your father. Meanwhile, we will contact the infection control team and our consultant to see if there is any chance to see your father with certain precaution. Is it okay with you?
Okay, doctor. Okay.
So do you have any further concern?
Yes, when you are expecting to move my father from this room.
Okay, actually, dealing with this bug is done by our multidisciplinary team, including the infection control team. Usually it takes about 10 days to 2 weeks to complete get rid of this bug and decrease the chance of transmission to anyone else. We will do such as some sort of follow-up samples from your father to make sure that he is clean of this bug. Thereafter, we can return to his regular room.
Okay, doctor. Okay.
You have any further question or concern?
No, doctor. Thank you. 1 minute left.
Okay, nice to meet you. I can give you some brochures, including more data about this bug. And how will you manage to go home?
Yes, doctor. I have my own car.
Okay, have a safe drive. So we have made today to discuss Mr. John condition. He came with bone fracture and now he get some sort of bug in his chest and become
Time
isolated.
over.
Nice to meet you, Mr. Smith.
Okay, nice to meet you, doctor. Thank you very much. Thank you. And you can say we will if the time is over, you can say we will arrange the another meeting. Yes, to complete our discussion or to complete our what we have started already. Okay. Nice to meet you. Nice to meet you. They will not stop you. Okay.
Amen.
Very well done. You have almost discussed everything. Like I want you to go back to the patient.co.uk and see how to explain hospital-acquired infections to the patient. It is very critical. This is very common exam case, extremely common exam case, not only very common, okay? You have to be trained about it. It can come in different ways, like in epilepsy. The epilepsy cases can come like a father or a son who took an illicit drug and develop fits, and the father is coming to ask about his son, and he may embarrass you with a question like, I think my son is taking something, doctor, and I think he's taking an illicit drug, and that's why he got this seizures. So please tell me, doctor. So the case can, or the scenario can include a lot of things inside, and the examiners can put and add and remove a lot of things. Okay.
Okay.
So the cases are the same, but they are not very classic. Inside the dialogue, inside the scenario, you may face new questions, different way of discussion, and so on. Okay.
Okay.
Please refer to a case of refer to patient.co.uk to see how to explain hospital-acquired infection or MRSA infection to the patient or his next of kin.
Okay.
You can simply tell him that we usually in hospital receive patients who are infected, and usually they have very difficult and very severe and resistant infections. And that's why the environment in the hospital is not like the environment at home. So sometimes patients acquire infection from the hospital, and this is happening everywhere. This is not only in our hospital, this is everywhere in the world it's happening and expected also. But we are expert in dealing with such conditions, as you mentioned. We have a very expert team. And your father is now okay. He is in safe hands. He's receiving the proper treatment, and he is in very good general condition, and so on. Okay.
Okay.
Refer to patient.co.uk and read about how to explain hospital-acquired infections to the patient. I think the discussion was was okay, was complete, and I have no more يعني concerns about your discussion. You make very good, انت very well done. ويعني ما فيش حاجة تانية تتقال بصراحة، انت عملت كويس قوي يا احمد.
الله يخليك.
والحالة دي لو جات لك في الامتحان انت هتعدي بسهولة جدا يعني. اوكي. مش هيبقى مطلوب منك اكتر من اللي انت قلته، بس هيبقى مطلوب منك بس explanation احسن من كده عشان تاخد فول مارك بس. اوكي. No need to tell him or to offer him a drive. Offering a drive is only in breaking very bad news and for the person himself.
تمام.
يعني الشخص نفسه، مثلا انت بتتكلم على واحد عنده جاله كانسر، واحد انت you are breaking bad news someone who has a cancer or he has renal failure, end stage renal disease, you start dialysis and so on. So for the person himself, not for the next of kin.
تمام.
بس كده. فيعني very well done بصراحة، وإن شاء الله يا رب إن شاء الله كده تيجي لك في الامتحان وتعملها زي ما عملتها النهاردة إن شاء الله بإذن الله، وأحسن بإذن الله.
الله يخليك.
حبيبي يلا، مش عايزين أي حاجة؟ مفيش أي حد عنده أي أسئلة ولا حاجة؟
تمام. شكرا ترشيد.
حاولوا تعملوا السيناريو ده بطريقة تانية، بطرق كتيرة. كل طريقة هتعملوها بيها هتلاقوها إن شاء الله بإذن الله سيناريو جديد، وهتلاقوها برضو هتديكم فرصة ان انتوا يبقى عندكم ملكات اكتر، وعندكم قدرة على استيعاب اكتر الحاجات اللي زي كده. بس وربنا معاكم ان شاء الله يا رب باذن الله، وبالتوفيق وبالنجاح ان شاء الله. السيشن الجاي ان شاء الله